Thank you for viewing this presentation on Alice in Wonderland syndrome. The objective of this presentation is to be able to discuss what exactly Alice in Wonderland syndrome is, to describe and define the symptoms and causes and possible causes, and the limited ways in which it is diagnosed and treated. Ideally, you will be able to gain an appreciation for the impact of this incredibly rare syndrome it has on individuals. Now, Alice in Wonderland syndrome is a collection of neurological symptoms that affects mainly children. Estimated occurrences as of 2016 are only 169 times since it was first identified in 1955. Alice in Wonderland syndrome is thought to be underdiagnosed due to the challenges in even identifying the syndrome and how quickly it affects people. Here I would like to introduce Sarah, a 12-year-old girl, and she was brought to the hospital by her parents who noticed that she was acting slightly odd and talking about odd visual experiences. Sarah described the feeling as if her body and surroundings were changing size and shape, and objects appearing distorted and exaggerating at times. She also felt that her body was either shrinking or expanding in size at different times as well. So when Sarah got to the hospital, a head CT was obtained and a urine tox screen was collected as well. Symptoms of Alice in Wonderland syndrome typically cause people to experience visual or spatial distortions. As you can imagine, this could be quite distressful and confusing at times, especially if you have not had this happen before and it just pops up. There are multiple symptoms that are commonly associated with Alice in Wonderland syndrome, and that's starting with micropsia, where objects appear smaller, or macropsia, where objects appear larger. You have metamorphopsia, where objects appear to change in shape or form, as well as with your distance, plopsia, where objects appear to be closer than what they really are. You have telopsia, where objects may appear farther than what they really are. You have issues with time distortion, where time may seem to slow down or move rather quickly, as well as body image distortions, where your body may appear to change in size or shape. Now, Jane reported experiencing these symptoms intermittently for several weeks. During these episodes, she would feel distorted and have difficulty navigating her surroundings. The symptoms would normally last for a few minutes before subsiding. It is not uncommon for symptoms of Alice in Wonderland syndrome to last for a few minutes to even several hours, and to occur spontaneously, or to be triggered by certain factors such as stress, possibly lack of sleep, maybe migraines. And as said before, these symptoms, if unexpected, can be quite frightening and lead to anxiety as well as panic attacks. While reviewing Sarah's H&P, it was identified that no significant past medical history of Sarah. It was also identified that there was intermittent distortions have started occurring past several weeks, maybe even up to 4 weeks ago. It was identified that she has no family history of mental illness or neurological disorders. While talking with the parents, said that Sarah was sick with a sore throat fever and the feeling of general malaise maybe 6 to 8 weeks ago. A blood test revealed that she was positive antibodies of Epstein-Barr virus. Also at this point, the head CT showed nothing, as in the urine tox screen was negative for any drugs as well. Since Sarah had a head CT and a urine tox screen completed when she arrived at the hospital, when both were negative, neurology was consulted, and the neurologist ordered an MRI of the head as well as complete an EEG. The MRI showed nothing abnormal, and the EEG as well showed nothing abnormal with brain patterns. The neurologist, taking into consideration Sarah's age of being 12, lack of urine toxicity, negative with like the head and MRI. But looking at her symptoms, neurologists decided that this is a diagnosis of Alice in Wonderland syndrome. There's a long list of reasons why people, mainly children, would experience Alice in Wonderland syndrome. Three of the main reasons are epilepsy, migraines, and infections. Other categories that have been thought to maybe create this syndrome are brain lesions, medications, drugs, and psychiatric disorders. The symptoms of Alice in Wonderland syndrome are attributed to functional and structural abnormalities of the perceptual system in the brain. On the whole, central pathology is considered the most prevalent cause. However, the exact cause of Alice in Wonderland syndrome is unknown, but it is thought to be related to abnormal activity in the brain's temporal or parietal lobes. It is important to note that Alice in Wonderland syndrome can occur spontaneously without any underlying medical conditions. However, thorough evaluation is necessary to rule out any of these underlying conditions. Looking at some of the differentials, top of the list is considered a migraine. Migraines can cause visual and spatial distortions that may be similar to those seen in Alice in Wonderland syndrome. However, these migraine auras typically last longer than the episodes seen with Alice in Wonderland syndrome, and it may be associated with other symptoms such as headache, nausea, and light sensitivity. With epilepsy, certain types of epilepsy can cause visual and spatial distortions and may be associated with other symptoms such as seizures, confusion, and memory loss. Brain tumors. Some brain tumors can cause changes in perception and may be associated with other symptoms such as headache, seizures, and weakness as well. There is psychiatric disorders such as schizophrenia and dissociative disorders may cause changes in perception, including distortion of time, space, and body image. You also have infectious mononucleosis. Alice in Wonderland syndrome has been associated with infectious mononucleosis, and this is a viral illness that can cause, as we saw with Sarah, fatigue, sore throat, and fever. And at the very bottom of the list is substance use. Drugs such as LSD and mescaline can cause visual and spatial distortions similar to those seen in Alice in Wonderland syndrome. Now, we've had several tests performed when Sarah came into the hospital. She did have an MRI of the head, a head CT completed, as well as an EEG and a UTOX. UTOX would have ruled out pretty much all of the well-known drugs for substance use. For migraine, she had no history of that, as well as psychiatric disorders, she had no history of that as well. EEG was negative for epilepsy, which means that she wasn't having a seizure at that moment, and that brain tumor was negative as well on CT and MRI. Which brings us to infection, and she was Epstein-Barr positive, and it is believed that this is, as we remember like the past slide, that infection is one of the three top reasons for experiencing Alice in Wonderland syndrome. The exact cause of Alice in Wonderland syndrome is not fully understood, which means there is no specific treatment for Alice in Wonderland syndrome. Most cases resolve on their own over time. In many cases, support and reassurance typically suffice since the symptoms are self-limiting and the symptoms of Alice in Wonderland syndrome are considered benign. So if treatment is necessary, it needs to be directed at the underlying cause, focusing on the use of anti-epileptics for epilepsy, migraine prophylaxis for migraines, as well as antivirals or antibiotics if thought to be an infection. As of note, antipsychotics are not prescribed because it's believed that these drugs may actually make the perception even worse. As we see from this picture, Sarah has gotten back to her normal ways of hanging out in trees. She's got her cat. She's listening to cool stories. Alice in Wonderland syndrome is a rare perceptual disorder that can cause distress and confusion for those who experience it. While there's no specific diagnosis, it is essential to rule out any underlying neurological conditions and monitor the symptoms. It is important to note, though, that Alice in Wonderland syndrome can also occur spontaneously without any underlying medical conditions. Thankfully, most cases, if not all of them, resolve on their own. But recurrent or worsening symptoms should always be tracked as well as evaluated by neurology. Thank you for taking part in this presentation. I hope you enjoyed it. There is one more slide coming up about a little background information on Lewis Carroll. Thank you. As just a little bit of background here, Lewis Carroll was the pen name of Charles Ludwig Dodson, an English writer, mathematician, and photographer. He was born on January 27th, 1832 in Downsbury, Cheshire, England, and died on January 14th, 1898 in Guildford, Surrey, England. Carroll is best known for his two children's books, Alice's Adventure in Wonderland and Through the Looking Glass, which were published in 1865 and 1871, respectively. These books have become literary classics and have been adapted into numerous films, plays, and presentations like the one you've just seen. In addition to his literary works, Carroll was also a mathematician and logician. He was a fellow of the Christ Church, Oxford, and published several papers on topics such as linear algebra and symbolic logic. Carroll also invented several word games and puzzles, including Doublet puzzle, which involves changing one word into another by changing one letter at a time. Carroll had a lifelong interest in photography and was an accomplished amateur photographer. He took many portraits of children, including several of the real-life Alice Little, who served as inspiration for his famous character. Despite his many achievements, Carroll was known to be shy and reserved, and he suffered from a stammer that made public speaking difficult for him. He never married or had children and lived much of his life at Oxford University. Now, it also, I think, is worth to point out that he did suffer from epilepsy, migraines, ADHD, as well as partial deafness. And it is thought that Lewis Carroll may have experienced similar perceptual distortions from his migraines, much as Alice did, giving him inspiration for his book. Thanks for paying attention. Take care.